the recent actions of the Treasury Secretary, Scott Bessent, halting all operations at the Consumer Financial Protection Bureau, CFPB, have thrown a significant wrench into the gears of crucial consumer protection reforms. This unprecedented move comes amidst a period of considerable upheaval within the federal government, marked by escalating tensions and a pronounced shift in regulatory priorities. The implications of this pause are far-reaching and impact millions of Americans grappling with the crushing weight of medical debt. The CFPB, a vital agency responsible for safeguarding consumers' financial well-being, was on the verge of implementing significant reforms aimed at mitigating the devastating effects of medical debt. These reforms, broadly supported by the public, are particularly pertinent considering the alarming statistic that approximately half of all Americans harbor genuine concerns about being financially ruined by a major medical event. This widespread anxiety underscores the urgent need for effective consumer protection measures, a need seemingly disregarded by the current administration's actions. The Republican Party's consistent opposition to these medical debt reforms has further exacerbated the situation, creating a climate of uncertainty and hindering progress towards a much-needed solution. This opposition, despite the clear and present danger faced by millions, highlights a significant disconnect between the political landscape and the pressing financial realities experienced by ordinary citizens. The abrupt halt to these reforms directly undermines the Biden administration's efforts to alleviate the burden of medical debt and protect vulnerable individuals from predatory financial practices. The timing of Bessent's decision is especially concerning, coinciding with the ongoing efforts of billionaire Elon Musk to gain access to federal payment systems. Musk's past pronouncements regarding his intention to delete the CFPB, a statement that reflects a fundamental disregard for consumer protection, add a layer of unsettling complexity to this already precarious situation. His ambition, coupled with the sudden halt in CFPB operations, fuels speculation about a concerted effort to dismantle essential consumer safeguards. The magnitude of the medical debt problem in the United States cannot be overstated. In 2020 alone, an estimated 46 million Americans had medical debt appearing on their credit reports. These negative entries, diligently reported by healthcare providers to credit agencies, cast a long shadow over individuals' financial lives, perpetuating a cycle of hardship and economic instability. A low credit score, a direct consequence of medical debt, severely restricts access to essential financial services, including loans, housing. It creates a vicious cycle of poverty and undermines the very foundation of economic mobility. The Biden administration's proposed solution, a policy designed to remove medical debt from credit reports, aimed to break this cycle. By preventing creditors from reporting delinquent medical debt to credit agencies, the administration sought to provide much-needed relief to millions of struggling Americans. This policy, representing a significant step towards a more just and equitable financial system, has now been indefinitely delayed by Bessent's actions. The initial skepticism surrounding consumer protection emerged on the very first day of the Trump administration, when a sweeping pause on all upcoming regulations was implemented. This early indication of a disinclination towards consumer protection set a worrying precedent. Bessent's recent order, echoing this earlier approach, effectively brings the implementation of the crucial medical debt reform to a standstill. This scheduled 4-March rule, representing a critical step in addressing the pervasive issue of medical debt, has been indefinitely suspended, leaving millions vulnerable. Further compounding the problem, Bessent has also been instructed to halt another vital regulation slated for October. This second rule mandates that debt collectors independently verify the validity of each medical debt before pursuing collection, ensuring that patients are not subjected to the insidious practice of upcoding. Upcoding, a widespread practice within the healthcare industry, involves billing patients for more extensive and more expensive services than those actually received. This deceptive practice further exacerbates the already crippling burden of medical debt, leaving individuals with inflated bills and depleted financial resources. The consequences of these actions are profound and far-reaching. Millions of Americans, already struggling under the weight of medical debt, now face an uncertain future. The erosion of consumer protection mechanisms, driven by political maneuvering and a disregard for the well-being of ordinary citizens, threatens to deepen existing inequalities and exacerbate the already fragile financial security of millions. The current situation demands immediate attention and a renewed commitment to protecting the financial interests of all Americans. The long-term consequences of inaction could prove devastating.